I'm Dr. Stephen Loyd. 16 years ago, I thought my life was over. I got addicted to pain medications, OxyContin, oxycodone, as well as benzodiazepines, Valium, Xanax, and I'd always struggled with alcohol. I crashed and burned. I thought that everything I'd worked for my entire life was gone. I'd been to medical school, through residency, was out into private practice, living my childhood dream of being a doctor. And then all of a sudden, it came crashing down. This is my story of what it's like, what it was like, what happened, and what it's like now. And to help me tell that story, I'm going to bring in my son, Heath. Well, I was in my last year of residency and had trouble in the past with alcohol. I knew I never could drink successfully, and I didn't drink all the way through medical school. And so when I got into residency, I really didn't drink through residency. And I'd have a beer every now and then, but nothing like it used to be. But on my way home from work one day in my chief resident year, I was about 6 months away from going into private practice, or actually taking a job at the university where I went to med school. And it felt like I had all this pressure on me. I mean, you and your sister were young and you were getting ready to start school, and she was even younger than you. And now my name's going to be on the bottom line. So I felt like I had all this pressure. And so I was driving home from work, and I was anxious, I was depressed. At the time I wasn't getting along with your mom very well. And I stopped at a red light in Johnson City where I was doing my residency, and I opened the glove compartment of my truck, and there laid some Norcos, hydrocodone, that I'd gotten from a dental visit months before. And I looked at those things. I'd never taken pain pills before. I mean, the ones I got from the dental visit, I just threw in the glove compartment of the truck. And I looked at those and I said, my patients take these things all the time. And so I reached over, I pulled one out. It was a little blue pill. I ripped open the package, broke it in half, and threw it in my mouth. It was 2.5 milligrams of hydrocodone. At the time, we were living about 10 minutes away. Mm-hmm. And by the time I got home, I felt like all that anxiety and that depression had melted away. Suddenly my life was a little easier. Yeah. The problems I had didn't seem as bad. And me and your mom seemed to get along better. Mm-hmm. So really it just eased the psychological pain and the emotional pain that I had going on from the. It just made my life a little easier. It made work tolerable. It made the stresses go away. But before long, I had to have it even just to get out of bed. The first time I was dope sick, I had no idea what it was. Yeah. Now keep in mind, I've been to medical school and residency. I'm board certified in internal medicine. And I had no clue what it was. I'd been a couple of days without Lortabs, which is what I was using mainly then. And I started to get really sick, and I felt like I was coming down with the flu. And I came home and told your mom, I think I'm getting the flu. And I went upstairs, got in bed, I was sweating, I felt feverish, I was shaking underneath the covers, and then I was burning up. And then the next day when I got my hands on the pills and I was better in 2 seconds, I was like, oh, I know what this is. And from that moment on, I had to have them to get out of bed. I had to have them to go to sleep. I had to have them all day long, every day. The rock bottom moment for me, though, there was still a period of time after that where I still used. But when this happened, I knew that something needed to happen or I was going to die. Mm-hmm. And so I was rounding in the hospital with the residents one morning. We always started out in the ICU. The sickest people are in the intensive care unit. And so I'm teaching medical students, medical residents, pharmacy students, pharmacy residents, and I've got them all around me. And so the very first patient we come up to was a female, and she was on the ventilator. She had overdosed the night before, and she had overdosed on Tylenol. And so my resident who was giving the report on the first patient, his name was Scott Brown. And Scott was outstanding, and Scott's going through her history and what happened, what brought her in, what we had done, what the plan was. And about midway through it, I stopped it and I said, hey, Scott, I was just curious, how many Tylenol did she take? And the number he gave me was less than I was taking on a daily basis. Because you got to remember, oxycodone and hydrocodone, when they're combined with Tylenol to make Lortab and Percocet, there's 375 to 650 milligrams of Tylenol in every one of those. And I'd gotten up to 100 pain pills a day, 500 milligrams. Mm-hmm. And so Scott told me that number, and I couldn't get the pencil down to the piece of paper to write my note. This is before electronic medical record. Because she's laying in there in a coma. We're getting ready to life flight her to Vanderbilt to look at a liver transplant. And I'm standing there and I'm taking that every single day. And I stopped rounds right then and I looked at the team and I said, you guys go back to, going around on your own. I never did that. And I walked into the restroom at the end of the ICU at the Johnson City Medical Center, and I closed the door and I locked it, and I sit in there for about an hour and I cried. And I was looking at the mirror and going, I don't know what's going to happen. I can't tell anybody or I'll lose everything I've worked for, but I can't stop. and I was going to die either way. And at that moment, that was the lowest I felt. And I actually contemplated taking my own life at that point. But thankfully I didn't, and went on for a little while longer. But it wasn't long after that before I got help. I walked in, and they took one look at me and knew the amount of medication I was using. Said, "You're going to have to go to detox." I didn't have any idea what detox was. And my best friend Darren had met me in the parking lot, and so he rode over to detox with me at the Vanderbilt Psychiatric Hospital. And I'm sitting in there waiting to be admitted, and all this stuff is going on. And he puts his hand over on my knee, and he said, "Steve," he said, "you can do this." He said, "Don't look at anything around you. Just keep your mind focused on what you need to do." And so I was in the detox unit for 5.5 days at Vanderbilt. And this is, Heath, where I started to get gratitude, even though I hadn't even been to treatment. Because at the end of those 5.5 days, there were 24 people on my ward, all of us with prescription pain pill problems and heroin problems and everything else in the world. I wasn't separated because I was a doctor. And I started to get gratitude because I was the only one of those 24 that got to go to an inpatient treatment facility after those 5 days. The rest of them were all young. I was in my early 30s, so I was young compared to what I am now. But they were teenagers and in their 20s, and they all had to go right back to the street after 5 days. And I have never gotten rid of that feeling that I had when I realized that. Because I realized, because of what I did as a profession, because I was a doctor, I was going to get much better treatment and care than they did. And so I left there and I went to hung out with Chip Dodd, who saved my life for the next 90 days. I learned about addiction. I learned about the difference between addiction and dependence. I learned how my childhood past of trauma, both physical and sexual, as well as my family history of substance use disorder, primed me to pick up that first pill, and how when I picked it up, that addiction was almost certain. And I learned things about myself that I didn't know. I didn't realize my own codependency. I didn't realize that my value was wrapped up in all these things outside of me. The fact that I had a medical degree, or I was a doctor. And as I realized these things and started to learn a new way to live, my life changed. And I thought, surely it can't be this easy. If I do these things, if I have these 8 feelings and then I acknowledge those feelings and I learn how to live with those feelings, and I learn that I can be okay no matter what. And if I learn to look at my role in things, no matter if I'm 1% at fault, the other person's 99% at fault, I can't change that 99%, but I certainly can change the 1%. And as I learned how to do that more and more, my life changed. And the ironic thing is that whenever I became willing to lose it all, I got to keep it all.
Yeah.
And my life has done nothing but go up since that time.